Mr. President, just following along further with my colleagues who were discussing the CMS report, Americans, of course, were told that the purpose of reform was to lower costs, to bend the so-called cost curve down. But the report released last night by the administration's own independent scorekeeper, as we've been discussing here on the floor of the Senate, shows that the Reid bill gets a failing grade. The chief actuary is the person the administration depends on to give it straightforward, unbiased analysis of the impact the legislation would have. This is an independent expert. This is the official referee, if you will. So this is quite significant. According to CMS, the Reid bill increases national health spending. According to CMS, there are new fees for drugs, devices, and insurance plans in the Reid bill, and they will increase prices and health insurance premiums for consumers. According to CMS, claims about the Reid bill extending the solvency of Medicare are based on the shakiest of assumptions. According to CMS, the Reid bill creates a new long-term insurance program, commonly referred to around here as the Class Act, that CMS actuaries found faces a, quote, very serious risk of becoming unsustainable. And CMS found that such programs face a significant risk of failure. The Reid bill pays for $1 trillion government expansion into health care with nearly $1 trillion in Medicare payment cuts. All of this I continue to be quoting from the CMS report. The report further says the Reid bill is especially likely to result in providers being unwilling to treat Medicare and Medicaid patients, meaning that a significant portion of the increased demand for Medicaid services would be difficult to meet. The CMS actuary noted that the Medicare cuts in the bill could jeopardize Medicare beneficiaries' access to care. The CMS actuary also found that roughly 20% of all Part A providers, that is, hospitals and nursing homes, for example, would become unprofitable within the next 10 years as a result of these cuts. As a result of those Medicare cuts, 20% of hospitals and nursing homes would become unprofitable within 10 years. The CMS actuary found that further reductions in Medicare growth rates through the actions of the Independent Medicare Advisory Board, which advocates have pointed to as a central linchpin in reducing health care spending, quote, may be difficult to achieve in practice, end quote. CMS further found that the Reid bill would cut payments to Medicare Advantage plans by approximately $110 billion over 10 years, resulting in, quote, less generous benefit packages, end quote, and decreasing enrollment in Medicare Advantage plans by about 33%. 33% decrease in Medicare Advantage enrollment over 10 years. So what should we conclude from this CMS report, Mr. President? The reports confirm what we've known all along. The Reid plan will increase costs, raise premiums, and slash Medicare. That is not reform. The analysis speaks for itself. And so this day, this Friday, is as we were discussing earlier, a seminal moment. We've heard from both CMS, the government's objective actuary, that the bill fails to meet any of the objectives that we all had in mind, and we heard from CNN about how the American people feel about this package. 61% oppose, only 36% support. So both the American people are asking us not to pass it, And the Center for Medicaid Services actuary is telling us it doesn't achieve the goals that were desired at the outset. How much more do we need to hear, Mr. President? How much more do we need to hear before we stop this bill and start over and go step by step to deal with the cost issue that the American people thought we were going to address in this debate? Mr. President, I suggest the absence of a quorum.